Hey, Dr. Gullberg here, continuing our infectious disease series. Today we're talking about acute and chronic sinusitis in adults. It's a very common problem that you're going to see in the outpatient setting primarily. It's probably an overdiagnosed condition. A lot of people obviously have chronic rhinitis or acute rhinitis related to respiratory infections, and if it continues long enough, it can get overdiagnosed as a sinusitis. Actually, sinusitis only occurs in about 1 to 2% of patients that have rhinovirus. That's a clinical diagnosis. There's no need to get sinus x-rays in your patients who you suspect having an acute sinusitis. That's only a waste of time and radiation to the patient. We're looking for fever. We're looking for purulent nasal discharge. We're looking for tenderness, especially the maxillary sinuses, but perhaps the frontal sinuses or the ethmoid sinuses as well. And we're looking sometimes for swelling associated with an acute sinusitis, and people that are actually getting worse with their infection at about 7 to 10 days out from the initiation of the respiratory infection. These are infections that are usually caused by pneumococcus, H. flu, and Varicella catarrhalis. Those are the prime 3 pathogens that we want to cover. Interestingly, however, initiation of antibiotic therapy with drugs like amoxicillin, or if they're penallergic, doxycycline, or even Bactrim for 10 to 14 days minimum is going to cure the vast majority of our patients who have acute sinusitis. For those people who do not get better after 4 or 5 days of treatment, these people then we have to move to the second tier treatment, and second tier of treatment including extended macrolides like azithromycin or clarithromycin. Of course, they are both generic and they have anti-inflammatory activities. Amoxicillin clavulanate would be another second tier antibiotic, as well as a second generation cephalosporin such as cefuroxime. Lastly, the respiratory fluoroquinolones, levofloxacin, and moxifloxacin are effective in this group of patients. And again, the extended treatment should last for an additional 10 to 14 days. Now, as patients develop a chronic sinusitis condition, the flora of the infection changes to more of an anaerobic flora, so that drugs like oral clindamycin or oral moxifloxacin, which has very good anaerobic coverage, or augmentin, same as amoxicillin clavulanate, are the drugs of choice. For patients who have recurrent sinusitis or chronic sinusitis, this is where we want to entertain coronal CT scan of the sinuses to look for obstruction or underlying allergies, or just a blocked passageway, maybe an anatomical defect. So hopefully this has been a nice summary for acute and chronic sinusitis in adults. Dr. Gullberg signing off. Thank you.